you with new customers.
It's open enrollment season, and MediShare is a Christian healthcare sharing ministry that saves most families about $500 a month. Google MediShare and see if it is a fit for you.
8:38. Let's check the roads. Team Hochberg Traffic Center time and Jim Talamonte.
In Highland Park, Green Bay Road is blocked in both directions between Park Avenue West and Elm Place. There's some debris down there. There was a possible lightning strike. We're looking at delays right now. The inbound Eisenhower, North Avenue to the Tri-State, western to the Burn Circle. It's 33 minutes, 390 to downtown. Outbound 30, it's heavy from 355 to 390. Inbound Stevenson delays are Ashland to the Ryan, 30 minutes, 355 to the drive. Outbound 30 after a crash at Pulaski. The Ryan runs 15 minutes, 95th to downtown. Outbound 14. Earlier crashes on the Adams Tollway have cleared. Eastbound Reagan Tollway, there's work at the left lane from the Aurora Toll to Eola. It's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next. In our 1-hour heating and air conditioning weather center, showers and thunderstorms today, high 73. Currently 55. Next news at 9 with breaking news as it happens. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Let freedom ring this afternoon at 2 with Sean Hannity on AM 560, The Answer.
Top of the morning, Dan and Amy. The secondary effects of the COVID-19 response. We've talked a good bit about it. There was a good piece in the Wall Street Journal this week from Dr. Jeff LeBenger and a colleague of his, Mike Meyer, about medical lockdowns causing disease surges. Right, we were talking a lot about how few patients are coming to get their chemo, to get treatment for heart ailments and other serious diabetes, other serious diseases, as it pertains to kind of year-over-year comparisons where there have been significant COVID-19 outbreaks, New York City, for example.
Yeah, we're missing regular screenings that we should, if you have a heart problem, you got to go to your cardiologist. People are just missing all of that.
So that's been discussed somewhat, but I don't know that it's been given the profile that it deserves, because there's so much interest in making this a lives versus dollars conversation rather than what it's always been, which is a lives versus lives conversation in terms of trying to achieve some balance, and also, ironically, right, flatten the curve to protect the viability of our health care infrastructure in this country. And by repurposing all or so much of the infrastructure strictly for COVID-19 and eliminating quote-unquote elective surgeries for so long, have you blown a hole in the economic model, the business model for so many healthcare centers, and resulted in actually weakening our healthcare infrastructure when the whole point of flatten the curve was to protect the strength of the healthcare infrastructure. It's a curious, confusing, often frustrating times. For more on this, pleased to be joined by Dr. Jeff LeBenger. He's the CEO of Summit Medical Group, City MD, and Mike Meyer, who's the president of Meyer Consulting and founder of CCX Cancer Summit. Gentlemen, thanks for joining us. Appreciate it.
Dan and Amy, thanks for having us.
Well, give us, whoever, this is a jump ball, so whoever wants it, give us a perspective on medical lockdowns and how they exacerbate disease surges, maybe even foment disease surges.
So this is Jeff LeBenger, Summit City MD. We see about 6 million visits in the New York metropolitan area per year. In our integrated model, where we have our own ASCs, where we take care of patients with cancer and other acute illness, we have locked down our ASCs for the past 6 weeks. That has put off, some surgeries that need to be done and some screenings that need to be done in the area. patients are very worried and they don't want to come in to see the doctor because they're afraid of contracting COVID-19. Although we screen everybody coming in, and everybody coming into our ASC, we do viral PCR testing on to make sure they don't have the virus and they're safe. But still, patients are worried. They're scared to come in to see their doctor, and they are putting off care that will be a detriment to the healthcare system in the near future.
Well, they put off the elective surgeries and screenings because they're worried about hospitalization numbers, and those numbers have gone down. Am I correct? I mean, was
Yes.
there, in your place of work, was there ever an issue with the number of beds available?
So we don't have a hospital. We are purely outpatient. But the hospitals that we rotate through, they became almost 100% COVID hospitals, and very little other care was done in those hospital systems. Our patients did not have any place to go for some of their surgeries. We took care of them. We have a large cancer center, so we took care of our cancer patients if we had fractures, things like that. But if you had semi-elective, like you had to go for a cardiac procedure, that was put off. If you have to have a screening like colonoscopy screenings, that is put off. It might be okay to put that off for maybe 1 month, 2 months, but when you're putting it off 3, 4, 5, you are really delaying diagnoses of cancer and other acute problems that you should not put off.
Now, let me contrast that. So I'm in Arizona, and where the hospitals in New York, New Jersey were packed, we've had minimal COVID cases. And so there's, Amy, there's a significant amount of capacity here in Arizona. And I think Chicago's somewhere in the middle, probably a little bit closer to Arizona. And I think we're not saying that what people have done was necessarily inappropriate, but this kind of one-size-fits-all, the idea that, you close down all elective procedures, it just we felt that this story needed to be done or needed to be told, and then the second thing, and Dan, you alluded to it in your opening, is the economic impact. You have a fair number of physicians, and Jeff runs one of the largest, but you have a fair number of independent physicians that are out there that run independent endoscopy centers, run independent oncology practices, and the economics of this have been terrible. When you talk about weakening the system, you have physicians out there that, at least in Arizona, for several months have not been able to do endoscopies when, candidly, they could have done them and not put anybody at risk because they weren't in the hospital.
Mm-hmm. And also, too, I mean, this goes down to children, too, and children's health. There was a story the other day, measles vaccinations down 60%.
Yes. Oof.
Right.
Yes.
Right.
Yes. We opened up a little earlier for vaccinations where we screened people coming in because we knew that was going to be a problem on getting vaccinations to children. But yes, that is an issue also.
Well, going back to New York, Dr. LeBenger, since that's the epicenter of the outbreak, resources from sort of every level were driven to New York City and New York State, but New York City in particular. What's your assessment of the allocation of resources that were done, particularly after you had those field hospitals set up with the SHIP and at the Javits Center? Was it an opportunity to move COVID patients to those facilities more quickly so as to open up the access to hospitals for these other procedures?
It's interesting. It seems like a wonderful thing to do to move to either Central Park or to the COVID hospital or to the ship that was there. Now, remember, the ship that was in the harbor was there for initially non-COVID, but that never really panned out. Once you're in the hospital and you're on these vents, and these are really sick patients, it's not that easy to move patients out, of an ICU to another institution. And it was just inundated, and the time frame, the quickness that these patients came in, that decompensated. Unfortunately, I don't think there was enough time to move them to other venues so you could open up and reallocate sources in hospitals to be able to do that. And remember, this is a very contagious virus. within a hospital, and hospitals sort of had to have been locked down to prevent that. You don't want to bring in a patient for surgery into a hospital that has 60 ICU beds and people walking around in and out, even though they're using PPE, around the hospital. You don't want to infect somebody who has cancer or who is going for a surgery with COVID. It's not as easy as one might think to move patients.
Mike Meyer, going back to the economics, I mean, what's your sense of where, I mean, you talked about individual doctors and practices or even groups of doctors and substantial practices. What's your sense of coming out of this, or even just as we stand here today, is our health care infrastructure, is it as strong, stronger, weaker than it was going into the response to this pandemic?
I think parts of it are weaker. I was on the phone yesterday with a physician I've known for years who runs a private practice out here in Arizona, very successful endoscopy center, very high quality. And, his situation is dire. The governor here, and I think this is true in Illinois too, I mean, the governor shut down all elective procedures, and his operation is away from the hospital. And so for the last 8 weeks, they've done they've pretty much done nothing. So, and so if it continues, now again, we're starting to open up here in Arizona, and so he'll probably weather this storm, but the economics of it going forward are still really difficult, because to go to your point about people being afraid to come in, people shouldn't be afraid to go into places like what Jeff is talking about at Summit, which has very good controls and is not inpatient. They shouldn't be afraid to go into physicians' offices, provided that the physicians have taken the appropriate measures. There's a lot of infrastructure that needs to be thought through here. Some of our big hospitals here in Arizona, and I think this may be true at Northwestern or Chicago or Advocate, you have to walk into the hospital and check into a central registration to go get a basic test. So you have all of these people walking into the hospital to go to various places. People are going to be afraid to do that. And so we have to do some simple things that or maybe they're not that simple, but we have to do some things quickly that get people over, this worry. You go out here to certain doctors' offices and everybody's wearing masks, and in certain other places, nobody's wearing masks. Mm-hmm. We know masks don't do much good for you, but if everybody were wearing masks, they could certainly, potentially help everybody else. So I just think, going back to your economic question, that it seems like we've kind of said, all right, we're going to write some big checks and we're just going to throw the money out there, rather than kind of saying, okay, where should the money go? And I personally think a lot more attention should be paid to the physicians.
And Mr. Myers, this affected you personally because your father passed away because of a delay of diagnosis. Yeah, no, this was obviously part of the reason that I wrote the article, and Jeff and I have known each other for a long time, and we thought that the story needed to be told because we're in opposite ends of the country, and we have completely different profiles. I mean, here in Arizona, hardly anybody knows a COVID case, and yet the governor shut down everything, and my father, unfortunately, needed a procedure called TAVR because he had aortic stenosis, and very healthy, 85-year-old, didn't have COVID, not overweight, not diabetic, great shape, but he had this heart condition which was diagnosed late, and then when he was supposed to have the procedure, we shut down all elective procedures. In that interim 6 weeks, he deteriorated rapidly, developed pneumonia. And to make a long story short, he never was able to get this procedure, and he died. And he is the classic collateral damage from this whole thing.
Lives versus lives.
Your point is right on, Dan. Lives versus lives.
Before we let you gentlemen go, I know in your piece in the Wall Street Journal, which we'll post, you have a number of recommendations based on what we've experienced, but assuming there is this second wave, and we don't know if it's going to be just as vicious, or as some are predicting it will have a second wave, but it'll be less vicious in the fall and the winter, and this will be with us. One or two things, because that's all most politicians can get their minds around, one or two things that you would recommend in terms of the response, the next time once we're out of this and all the states are in some phase of reopening, and then we're facing this again, or even something like this? One or two big takeaways that need to be remembered and thought through.
This is Jeff LeBenger. I think one is the federal government has to have better preparedness for something like this happening again. Two, I think that we have to look at healthcare a little differently, and we didn't have time to get into it, but virtual health and how you take care of patients, over the phone, through a video, how you could handle that and incorporate that into an office to practice, at least now, good social distancing, wearing masks when they come to the office. Because remember, I do feel that where an office could have handled 20 people coming in a day, they might have to handle 10 people coming in a day, because you have to practice social distancing within that office, and individual doctors have to realize that as you move forward, so they can bring the digital platform in for follow-ups and things of that nature to help nullify some of this condition.
He is Dr. Jeff LeBenger, CEO of Summit Medical Group, CityMD in New York, with Mike Meyer, president of Meyer Consulting and founder of CCX Cancer Summit in Arizona. Gentlemen, thanks so much for joining us. Appreciate your insights.
Take care. Thank you.
Hey, thanks a lot.
Thank you. And they both joined us on our turnkey.pro answer line.
It's like a hot, steaming cup of information to start your day. It's Chicago's Morning Answer on AM 560. The Answer.
Balance of Nature's fruits and veggies in a capsule. Changing the world, one life at a time.
I do have more energy, and it's not like energy that is like a caffeine high energy, but in terms of just having the vitality to go through the day, and there are times when I just notice that, you know what, I'm actually not tired. This is not tiring me. So I feel like my energy level is good and better than it was in times past. So I think that's a documented fact.
Don't wait to see what getting over 10 servings of whole fruits and vegetables every day can do for you. Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Start your journey to better health today by calling 1-800-2468-751 or by going to balanceofnature.com. Again, that's balanceofnature.com. And make sure to receive this special radio offer by using discount code CHICAGO.
I got a great night's sleep last night, all thanks to my pillow.